Certainly. Let's discuss the significance of the antinuclear antibody, ANA, test in the evaluation of musculoskeletal disorders. What is ANA? Antinuclear antibodies, ANA, are a group of autoantibodies produced by the immune system that target substances within the nucleus of cells. These antibodies can be indicators of autoimmune diseases, where the body's immune system mistakenly attacks its own tissues. The ANA test measures the presence and level of these antibodies in the blood, making it a valuable tool for diagnosing various autoimmune conditions, including those that affect the musculoskeletal system. Screening for autoimmune diseases. One of the primary uses of the ANA test in musculoskeletal evaluations is to screen for autoimmune diseases such as systemic lupus erythematosus, SLE, Sjogren's syndrome, and mixed connective tissue disease. These conditions often present with musculoskeletal symptoms, including joint pain and inflammation. A positive ANA test suggests that an autoimmune process may be occurring, prompting further investigation to identify the specific disease. This is especially important because some autoimmune diseases can have overlapping symptoms, making accurate diagnosis critical for effective treatment. Differentiating conditions. The ANA test is also helpful in differentiating between various autoimmune disorders. While a positive ANA can indicate the presence of an autoimmune disease, it is not specific to one condition. For instance, ANA can be positive in lupus, rheumatoid arthritis, scleroderma, and even in some healthy individuals. However, the pattern of the ANA can provide clues about the specific condition. Different patterns, like homogeneous, speckled, or nucleolar, can be associated with particular diseases, aiding clinicians in narrowing down the diagnosis and determining the most appropriate management strategies. Monitoring disease activity and treatment response. In addition to its diagnostic utility, the ANA test can also be used to monitor disease activity and treatment response in patients with autoimmune diseases. For example, in lupus, changes in ANA levels can reflect changes in disease activity. If a patient's ANA becomes more positive or the pattern changes significantly, it may indicate a flare-up of the disease that requires closer monitoring or a change in treatment. Conversely, a decrease in ANA levels after starting treatment can suggest that the disease is becoming more controlled, providing valuable feedback on the effectiveness of the therapeutic approach. In summary, the ANA test is an important tool in the evaluation of musculoskeletal disorders, particularly those associated with autoimmune diseases. It aids in screening for autoimmune conditions, helps differentiate between various disorders, and can be valuable for monitoring disease activity and treatment response. Understanding the role of ANA will enhance your clinical skills in diagnosing and managing musculoskeletal conditions effectively.